psychological and psychiatric support. In some cases, patients and their families may benefit from specialized psychological or psychiatric support. Coping with a mesothelioma diagnosis can lead to anxiety, depression, or other mental health challenges, which may require targeted intervention and treatment. Patient navigators. Many healthcare facilities have patient navigators or social workers who can assist patients in accessing support services, connecting with relevant resources, and addressing practical and emotional needs. Online support communities. In the digital age, there are numerous online support communities and forums where individuals affected by mesothelioma can connect, share stories, and find support from others facing similar challenges. Emotional support is an essential aspect of the overall care for individuals with mesothelioma. It helps patients and families better cope with the emotional roller coaster that accompanies a serious diagnosis, promotes a sense of empowerment, and fosters a more positive outlook on their journey. It's important for patients and their families to know that seeking emotional support is a sign of strength, not weakness. These support resources can significantly contribute to the overall well-being and resilience of individuals facing mesothelioma, allowing them to navigate the emotional challenges and focus on living life to the fullest despite the diagnosis. Palliative care and hospice. For patients in advanced stages of mesothelioma, palliative care focuses on improving quality of life and managing symptoms. Hospice care provides specialized support to patients in the final stages of their illness, ensuring their comfort and dignity. Palliative care. Palliative care is a specialized form of medical care that aims to improve the quality of life for patients with serious illnesses, including mesothelioma. The focus is on managing symptoms, relieving pain, and addressing physical, emotional, and psychosocial needs. Palliative care teams consist of healthcare professionals, such as doctors, nurses, social workers, and counselors, who work together to provide comprehensive support for the patient and their family. Palliative care can begin at any stage of the mesothelioma journey and does not depend on the prognosis. It is a holistic approach that addresses not only physical symptoms but also emotional and spiritual well-being. The goal is to help patients maintain their dignity and autonomy while maximizing comfort and relief from distressing symptoms. Hospice care. Hospice care is a specialized type of end-of-life care designed to provide comfort and support to patients who are in the final stages of their illness and no longer pursuing curative treatments. Hospice care can take place at home, in a hospice facility, or in some cases, within a hospital setting. The primary focus of hospice care is to ensure the patient's comfort and dignity during the end-of-life stage. A hospice care team, including doctors, nurses, counselors, and trained volunteers, provides round-the-clock support and care. They manage pain and symptoms, offer emotional and spiritual support, and help patients and their families cope with the challenges of this difficult time. Hospice care also extends its support to the patient's family, offering bereavement counseling and assistance during the grieving process. Both palliative care and hospice care are patient-centered and aim to enhance the overall well-being of the individual facing mesothelioma. These services are provided in a compassionate and supportive environment, with a focus on respecting the patient's wishes and providing care that aligns with their values and preferences. It is essential for patients and their families to discuss their options for palliative care and hospice care with their healthcare team as early as possible. Initiating these services earlier in the course of the disease can provide greater benefits in terms of symptom management, emotional support, and overall well-being for the patient and their loved ones.